What's up guys, welcome back to my channel. My name is Omar Daher, also known as Daher Radiology. I'm a radiology resident, and today we're going to be talking about tips for new radiology residents and some advice for starting call. So let's get started. Alright, so today we're going to talk about some tips for new radiology residents. If you're new here, I'm a radiology resident myself and I am learning the ropes just as much as anyone else is. So here's some advice for any new residents that are starting out in radiology. In our program, you do a year of off-service, so an intern year, and then you join radiology in your second year. So you kind of start as a year one radiology resident in your second year of residency. And it's a very, very large learning curve. So you're kind of never really exposed to radiology other than clinical services in your first year. And now you're going to be expected to start doing call very soon. And you have a lot to learn. Because when you're on radiology call, you're kind of the same as any other resident. Whether you're a junior or a senior, you're expected to take on a case that's just as complex. Whether that be a post-surgical abdomen, a trauma, dissection, very acute findings, they're all going to be seen on call. So what can you do as a new radiology resident to help prepare for that? And here are some of my tips for anyone who's just starting. So we'll start out with pre-call lectures. So hopefully at your institution, wherever you're at, you have good faculty, supportive faculty that may run some pre-call lectures for you. So these lectures are usually catered towards acute medicine, emergency medicine, radiology, and they go over basic approaches to how to read a, for example, dissection protocol, or a GI bleed protocol, or CTPA when you're looking for pulmonary embolism, or if you're doing stroke and you have to read that on call as well. These are all very fundamental scans that happen on a daily basis on call and are very, very high acuity, so you need to know what you're looking for to be able to appropriately guide management. So hopefully these pre-call lectures are hosted by your clinical staff, your fellows that may sit down with you and go over a topic that they specialize in. Sometimes these are a bit hard to coordinate because you have your own clinical responsibilities and your rotations that you're going through, but try and make sure that these things happen and that you get these pre-call lectures so that you can learn from the get-go good behaviors in terms of how to read different scans. When you're further in and you develop your own search method, it's hard to change sometimes, so having a good guidance early on is really important. That way you're saving time because you're focusing in on what's important and what might kill the patient in the acute setting, as opposed to kind of figuring it out with your own approach and not really knowing what's important and what's not important. So pre-call lectures are really good for that purpose specifically. So I encourage you to set those up and make sure that you have a broad range of categories that are fulfilled, whether it be from abdominal imaging to neuroimaging to MSK imaging and everything in between. The next tip that I would have is actually reviewing current overnight call scans. So at our institution, you can kind of just post the start date, the end date of the scans that you want to see, and then you can assign the user. So if you have the schedule for who's on call, you can look up that senior resident's last name and basically anything attached to the reports. And then that way you can actually go through all of the scans that they had done that night to see if there are any acute findings. And if there are, you can kind of screen through the reports and not going through the ones that were negative, but going through the ones that are positive And then that way you can see, number one, how it looks like on imaging and what it appeared. Number two, actually seeing what the history given for the patient was. Sometimes it's a very limited amount, and sometimes it's very specific to where you're supposed to look. And then number three, you would actually want to know how they worded it in their report. So it's one thing to be able to notice what you're seeing, but it's another thing entirely to be able to describe and to finally summarize a appropriate report with what you're seeing, as well as what management items might need to happen afterwards. So, seeing an acute appendicitis with a general surgery consultation recommendation, for example. So that's kind of a great way to get yourself exposed to many, many different cases, whole bunch of different types of imaging, and many different acute cases that are common. Because what's common is definitely going to show up more and more often when you review your cases for that previous night. And also, it's really institution specific, right? So what you see at one institution might not be what's common at another institution. So if you're doing your own review of your own institution, then you're likely going to see these things on call yourself when you start out. So reviewing call cases is a great way to get exposure for thousands and thousands of images, because really you can date back as long as you can possibly think. And really it's kind of a learning curve for everyone. So everyone kind of learns by, learning, going back to their previous studies and seeing what they did right and what they did wrong, and reviewing the surgical reports to see if it was an accurate description or an accurate call from imaging perspective. The next tip that I would have for new radiology residents that are starting out would be to look over Radiopedia review courses. So Radiopedia is a great site for really any level of radiology, but they have acute medicine, emergency medicine review courses that do a phenomenal job of going through a CT head, for example, and describing what bleeds look like, and going through many different modalities and describing what are acute findings, and actually going through cases as well. So these I found were very high yield because they were very relevant in trauma type medicine, things to look for in acute medicine. So I found that those review courses were great. Many different YouTube online videos, review courses have these type of overviews to reading scans on call, and I find that they're all a little bit different and they all have their pros and cons, but I would say that if you kind of take what you want from them and learn a generalized approach, then that would benefit you the most. These review sessions are obviously catered towards different specialties and may not necessarily apply to your academic center. For example, you may not read neuro on call or whatever it may be, but at least this way you can have a generalized approach. And I found that visual learning is the best for me, so videos on these topics are kind of what I look for. So it's a great recommendation if you are interested. They're actually not that expensive if on the Radiopedia page. And during the pandemic, they had some promotions that may still be going on for different videos, and they'd be great to check out. So check them out. The next tip that I have is looking at some radiology apps. So I found that when I first started, there were some great radiology apps on the iPad, on your iPhone, that you could actually access and learn from, but also use in a real-time setting. So some of these apps are provided by our institutions, so they do have a subscription cost to them. Not the best for anyone who's just trying to learn from any resource available. But there is a free app that was called A Night in the ER, and I found that was pretty cool because it actually went through a whole bunch of different cases with great images. You had the ability to scroll through the images as well, and it had a discussion about each case and what to look for and what not to miss. So those cases themselves I thought were a great overview to what you might see on call. Other than that, I would say that there are apps like StatDX, RadPrimer, eAnatomy. So these apps are great for looking up, you know, if you're having trouble with a case and you don't know what's going on, to actually look up what it might be. StatDX is great for differentials like that. eAnatomy is super helpful for actual radiology specific anatomy. So it goes through a whole bunch of different modality types and actual CTs that are actually going to show you what it looks like in real life. You can get access to that on your computer as well to scroll through, and it's just like as if you were scrolling through a case in a radiology platform. And your rad primer is kind of your curriculum based learning. So if you have a specific topic that you're trying to learn about, there's quizzes and self checklists and a whole bunch of resources for images and cases that are specific to a topic. So it's kind of like reading a textbook in that sense, but they're more specific, catered towards what you're looking for. So those, in summary, are probably really good things to have on hand when you're on call, and to look things up around cases, that you've learned something, that this is an acute appendicitis, what do I need to look for? And you can look them up on those apps to see, what are the accessory findings, what are the complications, what is the differential that this could be, to kind of supplement what else to say in your reports. My next tip for the radiology residents is one that's more obvious. It's reading textbooks. Textbooks are classic and they describe a whole bunch of different pathologies, obviously within a category that's in a nicely laid out fashion with a whole bunch of different images. Textbooks aren't the best way that I found learning, especially for call related issues, just because it's a more kind of formal flow and they explain everything, where you're trying to kind of hone in on what's important at this stage in your training. So, if you are looking for textbooks, some recommendations that people ask me about all the time are Core Radiology. Core Radiology has a very great overview on all topics in radiology. There's PDFs out there, there's the hard copies, they have, great illustrations. Sometimes the amount of cases that they have are not sufficient, but they definitely do a good job of giving an overview, and if you were to know core radiology, you probably would be great as a staff person one day. The other series is the actual case study series. So these are real life examples of case studies with images and a history and questions that follow. So if you wanted to look up the case review series on emergency medicine, it'll show you a whole bunch of cases on emergency medicine radiology, where you can actually see the image, the history, figure out what's going on. It'll ask you questions of what's the follow-up, what does this likely represent, what are future imaging modalities that should be requested. So it's a really great way to see many cases that are different than the ones maybe your institution might have. They're really good for actually training for your Royal College exams or your board exams. A lot of people use them for that purpose, but if you're just starting out, specifically picking out some of the case review studies might help you in, looking at emergency medicine, for example. I won't suggest any more textbooks other than that, just because there's so many out there, but, if you have some, or recommend some to, junior residents, then, leave a comment below, and I'm sure everyone else could benefit from that as well. So this next advice is probably specific to each individual person's radiology program. So at our institution, we actually do buddy call for our junior residents, and that means that they are gradually increased in responsibilities on call when they start out in PGY2. So it very varies from, picking up the pager to all the way to actually reporting the cases. And so that actually takes place throughout year 2, and then they eventually become independent in call by the end of that year. So that's a very specific, training facility specific resource, but it's important to ask your senior residents because they're the ones who went through it, they're the ones who are currently going through it, so they would have the best advice for your training. They're always supposed to be your mentors and your leaders, so you want to be able to ask them how best to perform in that program specific, and hopefully they're supportive in that sense, and that they're willing to take on some responsibility of teaching you the way, as I'm sure they were taught the way in their previous years. The nice thing about kind of going to your senior residents is that they're currently going through the hardship of what you're about to go through, so they are probably the ones that understand it the most. Look to the year above you. They're probably the most fresh into what you're about to experience. Look at the multiple years ahead of you to see where they've gotten and to see how it looks like on the other side, and then of course look at your senior years and your newly staffed colleagues and ask them kind of what would they have focused on, what would they recommend when starting out in radiology. And sometimes they'll tell you, well, if I could do it all again, I would do it this way, and that might be helpful for you to know. Finally, the last tip that I'm going to do is review, learn, and let go. And what that means is basically in all of the stuff that you do to prepare for call, when you start call, and even when you're going through call as upper year residents, always try to go back, review the calls that you made, the decisions that you did at 2, 3, 4 a.m. in the morning, and go back to see if you're right. Just go back to see what the surgical note says, what the admission note says, the discharge summary says, and see if you were right, and learn from mistakes and learn how to do better. Because without doing that, you're kind of just in the same position year after year making the same calls. And if you can't change your practice, then there's no point in learning. So it's really important to kind of review and kind of, go forward with it. And that being said, mistakes happen. So when you're on call, you're going to be making mistakes. That's the whole point of a residency, is to learn and to learn from your mistakes, but also to understand that everyone makes them. So when you make them, learn from them and then let go. Don't be bogged down by them. Don't let them act as your baggage. Learn from them and definitely move on, because it's very difficult to have the stress of residency and call in general, as well as the stress of, personally taking a missed case on and constantly reminding yourself of your failure. So with that note, I would say thanks for tuning in, everyone who currently watches my channel. I hope you're enjoying my content. If you are, give me a like and a comment, subscribe as always, recommend me to your friends if you wish. I hope to be making more content like this. Don't forget to continue following me on Instagram. I post a lot of content there as well. Sometimes we do case studies, sometimes we do learning about different anatomy series. So be sure to follow me on Instagram at Daher Radiology. And as always, if you have any questions or comments or suggestions for future videos, don't forget to message me, and we'll see you in the next one.